As a student health professional, I have noticed that a lot of focus is placed on mental health training and care, which is good because it shows that our supervisors are all aware of the impact that work stress has on student clinicians. However, as I entered the clinical setting, I realized that the process of mental health check-ins is not as easy as it sounds. Although we are all aware of mental health issues, the process of feeling comfortable enough to open up to other professionals, that is, our supervisors, is a very different story. And we often think that it makes us look different in comparison to others, so we just hide our feelings. My relationship with mental health has been an ongoing journey. But even with that, I just put it aside and keep working. Isn't it ironic? We are communication therapists who struggle to communicate our feelings. I think this is why health professionals struggle to form a therapeutic alliance with our patients. Because the main component of that is open and honest communication regarding wants, needs, and struggles. That is why understanding our own emotions and the emotions of others helps us to have a deeper and more meaningful clinical encounter. This enables us to have richer relationships with our patients and strengthens the therapeutic alliance. Mental health and therapeutic alliance are not always shown as the main factor of treatment because we follow a more direct treatment path to ensure that patients get the help they need as quickly as possible. This needs to change to ensure open communication, and this starts with health professionals being more honest with themselves. So ask yourself, when is the last time you tried to connect with a patient? How often do you do your own mental health checkups? And how important is therapeutic alliance in patient-centered care? This is important because those who are struggling cannot help others who are struggling. This often happens in the relationship between health professionals and patients if both parties have mental health issues. In the end, the therapeutic alliance suffers. Patients end up feeling like they cannot talk to their clinicians, which impacts the development of a management plan. And clinicians fear that if they open up about certain information towards their patients to form a better therapeutic alliance or with their colleagues, they will be labeled and stigmatized. In the end, patient care suffers, with the clinician only focusing on the patient's surface issue, and the patient feels ignored. This causes problems in the formation of a therapeutic alliance and patient-centered care, which ends up impacting both parties' mental health in the long run. Clinicians must shift their focus from assessment and intervention to relationship building, specifically in the early phases, so that they can hear the patient's story and express patience and empathy. This is needed as therapy is a collaborative process, and at the end of the day, the clinician is the guide, and the outcome of the therapy is dependent on the patient's commitment. Building that level of communication with our patients can often be very difficult, as we are often much younger than our patients. But I have noticed, specifically with elderly patients, once I just sat down and talked to them, we connected so well. And the patients ended up being more willing to try new activities and treatment, which ended up benefiting them in the long run.